My name's Scott Acord. I'm in Los Angeles. Today's date is August 24th, 2022, and I'm here with a colleague.
Hello, my name is Rosalba Salazar, but I go by Rosie. My entire family has never called me Rosalba. I am the Providence Charles G University Community Health Worker Academy project manager. I've been working with Providence for over 2 years.
How did you get into healthcare?
Ooh, my mother had a lot of health issues back in 1996. So I was 13 years old. And being 13 years old, I became my mother's primary caregiver. I was practically living in the hospital with her all my youth until college years. Because my mom doesn't speak English, I had to translate for her, care for her, had to take care of her wounds, walk her down the hallways of the hospitals for her to gain her health. In college, I just felt my calling was to go into the healthcare field, seeing that there's a huge need for bicultural, bilingual providers. I didn't understand the whole social determinants of health and how Latinos are more affected in the lack of healthcare access and equity. I then became an emergency medical technician for 5 years. I worked in the ambulance. Then I worked in the ER and I cared for so many people that didn't speak Spanish. I was their translator, and I just saw that there was a huge need for education for primary care. One day I was working in the ER and a patient came in. She was a 35-year-old female and she came in with the chief complaint of leg pain. So I took care of her. I went into the room, I introduced myself, and when she lifted up her pants to show what was the issue with her leg, it was such a deep wound that her skin was practically rotten. And she didn't speak English, so I did all the translation for her. She didn't have health care, so she didn't see a provider. She didn't have access to healthcare. She didn't have access to health insurance. She had no knowledge about diabetes. We did a glucose test on her and came out that she's diabetic. And I asked her, did you know that you had diabetes? And she said no. And unfortunately, they had to amputate her leg at the age of 35. And for me to give her the news that she is diabetic, it really did something to my spirit and my soul, where I said, that's it, I have to do something. So then I became a personal trainer, learning health and prevention and exercise and nutrition. And I started helping out my family. I started to help out friends, and then I got clients. And then I thought, I want to give this to the people that can't afford to go to the gym and exercise or don't know how to exercise. That's the population I want to serve. I want to serve people like me, like my mother. So I made it my mission to change that. And I went back to school, got my master's in public health, and I implemented a health and fitness and wellness program at the Centro Salud Cultura, which is a community center by Cal State Long Beach, placed in the most vulnerable community in Long Beach. I was granted a fellowship that was funded by the USDA. I was able to have the opportunity to be a graduate fellow. So I did health education for the community for this research project, Sanos y Fuertes, Healthy and Strong. And there I met the most amazing angels, community health workers. So this was 8 years ago. And so I worked with community health workers, and they taught me so much on how to really talk to the community, how to really engage the community and teach them prevention and teach them disease care management, all of that. From there, just it grew to teaching the community, to teaching students. I love mentoring. I was adjunct professor at Cal State Long Beach, and then I transitioned to being a health educator in a clinical setting, partnering with doctors, nurse practitioners, and I saw so many patients, 400 patients in like 5 months. And then by God's providence, I had this vision of working with community health workers because I know that there was a need. I know that there is a need. And by God's providence, I ended up at Providence Healthcare Services that gave me that opportunity to do what I'm doing today.